Well, hello. How are you? Welcome on in. Welcome on in. My name is Dr. Eccentric. Hello. Nice to meet you. Yes, most people just call me Dr. X. It's whatever you prefer. So, I see you're a new patient here today. So what brings you in? Okay. An infection in your hand. Got it, got it. All right. Let me just take a look at your hand real quick, if that's all right. Yeah, it's definitely infected. You're right about that. So, let me get my chart out here. Let's see. Okay. So go ahead and state your name for me. Okay. Okay, and how old are you? Okay. And your birthday? Okay, yeah, just confirming basic information on you here. Okay. And do you know your blood type? Okay. That's okay. We can always run a test for that if you don't know off the top of your head. A lot of people don't. It's totally normal. Okay. And when and where did this occur? Okay. About a week ago. It's gotten progressively worse. Understand. Okay, and where did this happen? At your work? Okay. And what do you do for a living? Work at a lumber mill. Okay. So, I'm no expert on lumber mills, but I'm going to say that because you work at a lumber mill, there's a high probability that you have wood shards or splinters in your hand that have just stayed in there and have caused it to become infected. Yeah, you think so too? Okay. Glad we're on the same page there. Alright. Yeah, the fact that you work at a lumber mill, I'd say high probability it's most likely wood that is causing all of this. Alright. And you can't get the splinters out. Yeah. They can be a bit tough sometimes, for sure. Alright, and do you have any food or medicine allergies that I need to be aware of? No. Okay. Wonderful. And do you have any pre-existing medical conditions? No? Okay. You're fit as a horse. Okay. This is the first time you've been to a doctor in 10 years. Okay. All right. Yeah, I think a lot of people only go to the doctor when they absolutely need it. I completely understand. Alrighty. So, I'm going to go ahead and get your vitals first, and then we're going to check out that hand, okay? Alright. So I'm going to start with taking your temperature, okay? Let's see if this infection has caused a spike in your temperature at all. So let's see here. Okay. Okay, 101. That's not too bad, but it's not too good either. So I think the infection is probably causing your body to heat up and causing a fever there. So yeah, I'd definitely say we are dealing with an infection. Okay. Let's see here now. Let me go ahead and listen to your heart. Okay. Alright, I just want you to relax. And when I tell you, I want you to breathe in, okay? And then breathe out. Okay, so go ahead and breathe in and hold it. Ba-bum, 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 ba-bum. breathe in for me one more time. Ba-bum, 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 ba-bum. And breathe out. Good job, good job. Okay. Well, your heart rate sounds normal, so that's good. Doesn't seem to be any issues there, so I'm happy for that, of course. So, let's see, let's get your blood pressure. Okay, I'm just going to put this little cuff on you here. Okay, your blood pressure seems to be normal. I'm just going to go ahead and I'm going to look in your eyes, okay? All right, let's see. Okay, and your other eye. All right, everything seems fine there. Okay, other than a high fever, everything else seems to be okay, but we're gonna take care of this before it gets any worse, okay? I don't want it to get any worse because you could start having other problems if we leave this unattended. So, I am going to take your hand and I am going to try to pluck out the wood shards and the splinters. I'm going to need you to hold very still, okay? I'm going to go ahead and sanitize the area first. And what's going to happen is I'm going to be upfront with you, okay? If I can't get them out with a pair of tweezers, I will have to cut into your hand, okay? To actually open it up so I can see to remove the wood shards. I'm going to try everything I can to not have to cut your hand, but the way it's looking, I'm not 100% sure, and I might have to resort to that. Okay. Yes, I will numb it before I do that, okay? If I need to cut. I'm going to try everything in my power not to have to do that, though, okay? All right. So let me see your hand. All right. And I'm going to go ahead and put on some gloves. Stings a little. Yeah, that just means it's killing the germs, which is what we want. So, I'm going to take these little tweezers and I am going to, let me see your hand there. Okay. All right, brace yourself, okay? Just a little prick, okay? Is really swollen. Pluck, 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 pluck. Okay. Pluck, 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 pluck. Okay. Pluck, 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 pluck. I'm trying to move a little bit of this back so that I can get to the wood shards in here. Pluck, 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 pluck. It's like I'm just grabbing the very tip of it, but it just doesn't want to move. It's like it's really jammed in there pretty good. Pluck, 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 pluck. Okay, this is yielding absolutely no results. So, unfortunately, I think I am going to have to cut. Alright. Let me go ahead and numb your hand. Okay? Alright, I'm going to sterilize first. Sterilize your hand first, yeah, because I just can't get in there to get those shards. They are deep in there, and they are just like barely poking out of the skin, and I cannot get them without actually making an incision. I am so sorry. Alright. Just a little sanitizer. And now what I'm going to do is I'm going to take this numbing agent and I'm going to stick it right into your hand, okay? You're going to feel a little sting. I just need you to stay as still as you possibly can, okay? Can you do that for me? Alright. Alright, on the count of 3, okay? 1, 2. Okay, there you go. Yeah, we usually go before 3. It's alright, though. Okay, so I'm going to take my scalpel and I'm going to just make a small incision into your hand, okay? Alright, so first I'm going to press on your hand to see if it's numb. If you can feel anything, I want you to let me know, okay? Everybody has a different tolerance when it comes to numbing agents. So if at any time you feel anything, you let me know, okay? Because you should not be able to feel anything. Okay, I'm just going to gently tap on the area. Can you feel that? No, not at all? Okay, that is good to hear. Alright. You're okay? If you get squeamish, feel free to turn away. You can turn your head and I will do this. You're okay? Are you sure? It's okay to turn your head. A lot of people have an aversion to blood. Okay. Alrighty, let's get cutting. Okay. Okay, I see them now. I can definitely get in there and get to them now, so. Pluck, 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 pluck. Okay. Pluck, 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 pluck. Got one. Pluck, 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 pluck. There's 2. Pluck, 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 pluck. 3. You got quite a few shards in here. Pluck, 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 pluck. 4. It looks like it was all part of one shard that just broke into pieces. Pluck, 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 pluck. Okay. 5. Pluck, 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 pluck. 6. Pluck, 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 pluck. 7. Okay, I think that is all the shards. You had 7 shards in there. Wow. Okay. Okay, so what I'm going to do now is I'm going to spray more antibacterial spray. Okay. And we're going to go ahead and we're going to get that wound closed up, okay? It's just a small incision. Probably need like 4 stitches and you should be good. So let me go ahead and get that going here. Okay. Take my needle here and I'm going to go ahead and stitch you up real quick, okay? You still can't feel anything, correct? Okay, wonderful, wonderful. So let's go ahead and get this done. antibacterial spray. All precautions taken. Don't want you getting infected in any way, shape, or form. So I'm going to lay this right on your hand there, okay? And I had to give you 4 stitches, okay? Okay. And now what I'm going to do is I'm going to take some bandage and I'm going to wrap your hand, okay? So I just need you to hold really still. Alright. I'll go ahead and wrap that for you. Okay, and just a little snip snip. Okay. There we go. That's all wrapped up for you now. Okay. So what I'm going to do now that is done, all of the shards were taken out, so your wound should have time to heal now without being reinfected. But just in case, I'm going to give you some antibiotics to go ahead and take with you, okay? I want you to take these twice a day, okay? Twice a day. For about 2 weeks until the infection is completely gone. Do not skip a dose and do not double up on a dose, okay? That is very important. Take exactly as directed. Twice a day for 2 weeks, okay? That way the infection will clear up and you shouldn't have any chances of getting reinfected, okay? Alright. Also, make sure you keep that area clean. Make sure you change the bandage as often as needed. I will also give you some disinfectant spray for that, or antibacterial spray for that. You can also put some triple antibiotic on it if you want to help it heal faster, and that way you don't have like a really nasty scar from the incision. It shouldn't be too bad. And in about 2 weeks, when you're done with your antibiotics, I want you to come back because I'm going to take your stitches out, okay? Because by then it should have been healed. But make sure you're changing your bandage every day, at least once a day. Make sure you clean it with warm water and soap, antibacterial soap if possible. And just try to avoid getting it reinfected, okay? So if you have to, just wear a glove or something on it if you're working. But your hand is going to sweat when you do that, so make sure you are changing that bandage pretty often if you're wearing gloves to prevent further infection. Okay, I am going to write you a prescription for those antibiotics. I do have these ones right here, but I only have enough for the day that you can take with you right now. But as soon as you leave here, I want you to go and fill this prescription, okay? There's actually a pharmacy right down the road here, okay? It's like less than a mile. Okay, so I'm going to go ahead and I'm going to write you that prescription for some antibiotics. Okay, and I think that is it. Just remember to keep your wound clean and change your bandage often and take your antibiotics twice a day for 2 weeks. And I will see you in 2 weeks' time to take out your stitches, okay? Alright, yeah. You have a good one, okay? Take care now. And don't hesitate to come see me if there's any problems that should arise between